On today's episode of my fertility podcast, we're welcoming Courtney and Aparnaa. They join us on episode number 45 to talk about the impact of vaginismus on fertility and how pelvic physiotherapy can help with that. Now they're back because we love them and you guys love them too. They're back talking about topics around pregnancy and postpartum and the role of pelvic physiotherapy on those stages of life.
Courtney is a physiotherapist who works at Cornerstone Physio in Richmond Hill. She has been working for over 15 years and in the specialization of pelvic floor physio for 10 years. She loves working with all sorts of pelvic conditions, including incontinence, pelvic pain, vaginismus, and helping women prepare their bodies for birth. She finds it truly rewarding to get patients back to meaningful life activities and or living a better quality of life.
And Aparnaa is also a physiotherapist at Cornerstone Physiotherapy in Richmond Hill, and she specializes in pelvic health. With 2 years of experience, she treats both male and female patients with varying degrees of pelvic floor conditions, as well as supporting women and preparing them for childbirth. She's also a CrossFit athlete, so Aparnaa loves teaching patients how to engage the pelvic floor during exercise without fear of making it worse or weakening. She helps incorporate pelvic health into your regular fitness routine. She's dedicated to restoring function, improving quality of life, and supporting her patients in achieving their goals, whether that could be overcoming pain, preparing for childbirth, or enhancing athletic performance.
Welcome back, Courtney and Aparnaa. We're so glad to have you back to tell us even more about pelvic floor physio. But let's start with the basics, maybe for our listeners who haven't heard the previous episode that you guys were on. What is pelvic floor physio? Why does it matter? Why are we talking about it?
Thank you for having us back. We're excited to be back. So pelvic floor physio is a specialized area of physio. So when we go through our undergrad and our master's in physiotherapy, this is not something we currently learn. So it's postgraduate education we take. And the reason for that is because it involves an internal exam. And that's because your pelvic floor muscles are mostly on the inside of your pelvis. So to assess those, we have to do an internal exam, or that is the gold standard, I should say. We use our digits, our fingers, instead of like a speculum, which people are probably more familiar with pap tests. And the reason for that is because we need to feel. We're feeling what the muscle is like in sense of tightness or tone. And then also its strength. So we're checking how well someone can squeeze and lift. And so we can't get that feedback without using our fingers. If we're using an instrument, we can't tell that the same. So that's really what the difference between regular physio and pelvic floor physio is. At Cornerstone, where we work, all our pelvic floor physios are also orthopedic physios. So we do look at, and because there is interconnection to the low back, hips, thighs, all of that stuff as well. So for some people, that's going to be relevant and play into things. There's pelvic floor muscles that are hip muscles as well. So it can affect all of those areas. So we will involve that in the assessment if we feel like that is necessary for that person.
Can you tell us a bit about the common concerns that you see in pregnancy from the point of view of the pelvic floor?
So the most common things we see in our practice would be low back pain during pregnancy, and that can be related to your core, which your pelvic floor is part of. That would be something that we would be addressing as a pelvic physio. I would say if you're pregnant and you have pregnancy-related low back pain, so you haven't had a history, or you might have, but it came on with pregnancy this episode, it would be best to see a pelvic floor physio for that rather than your typical orthopedic, so that they can look at you particularly to what happens during pregnancy and the contributing factors to that current episode. Another thing we see a lot is pelvic girdle pain, which if people aren't familiar with, is pain kind of around the pelvis. So it could look like groin pain. It could look like SIJ pain, which is kind of the low part of your back, where what people would call their tailbone is. Anything around the pelvic girdle, which is like a ring, basically. So pubic bone, groin, and then SIJ. That's pretty common to occur in pregnancy specifically. Again, you would want to see a pelvic floor physio for that. And then your typical things that we see in pregnancy, but also this is a majority of what we see as pelvic therapists to begin with, is incontinence. So leakage of urine is quite common during pregnancy and after. as well as prolapse or like a heaviness of feeling of the pelvic floor musculature that they didn't have before. Another thing that we get are a lot of people asking about what they can do, what they can't do in terms of exercise and restrictions around pregnancy. Because I think there's a lot of misconceptions and a lot of different views on that, and it can get confusing for people. I'd say that is the most of what we see.
For pelvic floor physio, I mean, you deal with so many of these conditions, but is there ever a time, is there ever a concern where you would advise someone not to see a pelvic floor physiotherapist?
Yes, there is, but it's pretty uncommon. Generally speaking, our internal assessments are very gentle and not aggressive or deep comparatively to other things people might be doing in this time. So if you think about intercourse, we're using one, max two fingers, and we're not going deep or anything like that. So if you haven't been advised to abstain from intercourse, then you should be fine to do an internal pelvic exam. We're also not going like right to the cervix. So often you're going to be checked by your OB or midwife, and they're going to be looking at your cervix. We don't go that deep in our assessments. We're looking just at the muscles. It's very gentle and pretty superficial relative to other exams that you might be having in that time. So generally very safe. Only if you have a high risk pregnancy or a condition that you've been told to be like on complete bed rest or to abstain from intercourse would be people that we wouldn't be doing that exam, because we just don't want to risk anything in that situation.
Now, having been pregnant twice myself, I would ask, even if patients don't have any symptoms, and I say this because I don't know anybody who doesn't have any symptoms when they're pregnant. But let's say there's no incontinence, or let's say they don't have anything like really significant. Do you think that all pregnant women should be seeing a pelvic physiotherapist to sort of understand what is happening to the pelvic floor, how to rehabilitate it postpartum? And like I said, I don't know anybody who's pregnant who has no symptoms whatsoever, at least some back pain or some difficulty walking and getting off a chair and things like that.
Yeah. Yeah. It is pretty common. The pelvic girdle pain is like very common, and the symptoms with that are transition. So getting up from sitting or turning in bed where they get that sharp pain. There are women that do really well through pregnancy and are asymptomatic, but I do strongly believe that everyone should come see a pelvic physio. And I think that is probably the biggest hurdle we have currently, that a lot of patients or the general public don't know that we exist or what we do. OBGYNs, midwives definitely do, although they kind of think about referring to us only when there is problems. So only if their patients are saying, I'm peeing or I'm having this pelvic girdle pain, then they send them to us. So there's a lot of things that we can do outside of just helping manage the symptoms that they currently have. We can actually prevent those symptoms from happening and help with the labor and delivery and prepare them. So I do feel pretty strongly about this because we know it's something we can prepare for. So your pelvic floor is like a sling of muscles that holds up against gravity, against the weight of the baby. And so when you're pregnant, there's pressure down on those muscles, right? And growing pressure. And so we know that being pregnant has a little bit of a hit, meaning makes those muscles a little less functional. And then delivery, often there's tearing or maybe episiotomy, so a cut, at the very least intense stretch with a lot of swelling. So if you think about that in any other muscle, if you had a big stretch of a muscle and like a little tear in it and it's swollen and sore, it's not very functional, right? It hurts. It's not functioning at its best. So delivery also has a hit to that pelvic floor function. And we know this is coming, right? So we know that anyone carrying a baby and delivering a baby is going to have this drop in function because of that. And we can prepare for it. Whereas with an injury, if you're playing soccer and you roll your ankle, you can't really prepare for that. You don't know, right? That that's going to happen. We know this is going to happen. So why are we waiting until problems until we address it, right? We can actually build up the strength, build up the resiliency so that we prevent these problems as best we can. Obviously, it's not going to be perfect, but so for example, if we were just trying to make it easy to understand, your pelvic floor works for giving you continence, right? So if you have good strength it can close off your urethra and give you continence. If 100% is the best strength, like below 50% is where you would become symptomatic. I'm making these numbers up just so people can understand. But if we say that you're functioning at 70% during pregnancy, but then you're going to take a little bit of a hit in pregnancy and then delivery, the likelihood of you becoming symptomatic, so you might not be symptomatic during the pregnancy, but then after you become symptomatic because you've taken this hit and now your function isn't above the 50, it's lower, it's at the 40. And so you're going to start to develop these symptoms that you didn't have before. The other thing is people don't know what their strength is. People are very disconnected from this area. It's not like any other muscle that we can see and test easily with a weight at the gym, right? Like we all know probably how much of a weight we could bicep curl at the gym. Can we do 5 pounds? Can we do 25 pounds? No one knows unless they've seen a pelvic physio how strong their pelvic floor is, if they're doing a Kegel properly. And they also don't know what kind of strength they need for function, right? So if you want to return to running, you need a very different strength and control than if you just want to be walking. And so I feel like people are walking around blind. They don't know how strong these muscles are. They don't know how to do the Kegels, and they don't know what they need it to be to go back to activity or to do activity. So we would be giving all of that education and that assessment, how strong they are, if they need to work on it or not, are they doing it properly? And then talking to them about the fact that it will take little hits. We want to build that resiliency right now to avoid that in the future. The other thing that's really helpful with that is it's hard for people to figure out how to do Kegels often. It's especially hard postpartum. So postpartum, those muscles are swollen, sore. They're not functioning well to begin with. If you've never done a Kegel in your life, you're not going to know how to do that properly in that moment. But that's something that we would encourage people to do right off the hop, like within a few days of delivering. Kegels are things they could be doing. It actually helps to pump some of that swelling out and helps to get those muscles contracting again quickly. We don't see them right after pregnancy, so it's not something we can teach them internally, but if they know it from before, they will have that motor memory and understand if they're doing it well or not after. So it also helps them on that end. So yes, I think everyone should be coming to see a pelvic physio with symptoms or not.
That makes sense. And in the postpartum period, you're sitting there for long periods of time with the baby in arms. So I think that would be the perfect time to be like,
Right?
Kegel away.
Yeah.
I know what I can do to make things better.
Yeah.
And just to clarify, because this is a common point or a common misconception, debunk this myth, if you will, that if you have a C-section, your pelvic floor is like perfect.
There's definitely the pros and cons with either direction that you take. And I get patients ask me this question all the time. Do you think a C-section will be easier on my pelvic floor than a vaginal delivery? I always tell patients, regardless of if it's a C-section or a vaginal delivery, you are still carrying your baby using your pelvic floor muscles for 9 months. And as Courtney mentioned, those muscles, it's heavy physical demand, right? So for 9 months, as baby's continuing to get bigger and bigger, your muscles are working quite hard, which means regardless, there's going to be a similar impact to your pelvic floor muscles and similar postpartum complications. Even though you're not pushing your baby, with the C-section, again, pelvic floor muscles are working overtime. So regardless of whether it's a C-section or vaginal delivery, we recommend that patients come in for an assessment. We recommend as early as like second trimester to get that baseline assessment, get them working on strengthening their pelvic floor muscles if that's appropriate. And again, as Courtney mentioned, if they learn that ahead of time, they're going to be way ahead of the game when it comes to that postpartum period. They'll already know how to engage their pelvic floor muscles, and they're already doing the best thing for them to help prevent any complications that could occur afterwards, even if they don't experience it immediately postpartum.
I would add to that actually too that a lot of C-sections are not planned. So there's a lot of emergency C-sections that happen. So there's a good chunk of our population that go in not expecting to have a C-section and end up having a C-section. And in that case, the likelihood that you have been laboring and potentially pushing for a while is high. They usually aren't putting you into emergency unless there's an issue of getting baby out and there's someone is at risk, right? So you kind of have both worlds then. You've actually like partly done a vaginal delivery, or at least put strain on those muscles and stretch them, and you're going to have all that going on. Then you also have an abdominal surgery on top of that. And so it's best to prepare, because you never know what's going to happen unless you have a planned C-section. But even still, you are undergoing an abdominal surgery, and they're stretching those core muscles, which your pelvic floor is part of a core. They're not stretching the pelvic floor muscles, but they are the core abdominal muscles, opening that. And so they work as a unit, those muscles. So you're going to need to rehab after that, right? It's important to understand how those all function together.
And speaking of abdominal surgery, I think that's a big thing that a lot of patients forget, is that C-sections are a major surgery. And there are like other complications that can come with that, aside from weakness of the pelvic floor as well. And something that we educate them on when they come in early during pregnancy is scar treatment and that timeline. What are some things that they can do from like 0 to 3 weeks, 3 to 6 weeks before they come see us 6 weeks, and we actually start scar treatment or scar management?
Speaking of C-sections, another question that I have along the same lines of Dr. White's prior question is, can pelvic floor physiotherapy actually help reduce the likelihood of having to have a C-section or having to have a vacuum delivery during labor? And I have seen on Instagram all kinds of things that people think they should do, like the one and the massage and all the things which are not evidence-based. I would love for you to talk about what actual pelvic floor interventions have shown from the evidence point of view to reduce the risk of interventions during labor.
So why don't I start with how pelvic floor physiotherapy actually helps with like labor and delivery preparation, and then talk through how that can also help minimize the risk for other interventions or complications. So we begin labor and delivery preparation specifically around 35 weeks. So there's no like risk to induce early labor. And it doesn't mean that if you start at 35 weeks, you're going to go into labor that week or the next day. But we start preparing for labor and delivery around 35 weeks to ensure the body is ready and to reduce the likelihood of these complications that you've mentioned. So we will do things such as perineal stretching, which gets the brain and body comfortable with that sense of pressure or stretch that a patient will experience during delivery. And we also teach them how to breathe to manage their pain as well, which is not only going to be helpful when they're actually pushing out their baby, but even breathing techniques to help manage pain during labor as they're experiencing contractions. And then we have pushing techniques. We guide patients through effective pushing techniques to work with their body's natural rhythms. Unfortunately, when they're actually in the delivery room, there's not enough time for an OB or a midwife to give a patient clear instructions on how to push out their baby. They will feel that sensation to push, but may not know exactly what to do. And oftentimes the cue that they will get is, I want you to hold in your breath and push with all your might as if you're having a bowel movement. But even with that, like patients will get stuck, they'll get confused, and they don't know what to do. And they often end up pushing down towards their bum, not actually going down and up through that vaginal canal. And that's often reasons why they may need to cut, so an episiotomy, or they may need to use vacuums or forceps to continue to help baby down through the vaginal canal. Labor positions is also very important as well. So, what are some things that you can do between contractions or during contractions to help you manage pain, but also to speed up labor if possible? And we use upright positions like standing, squatting, on your hands and knees to encourage baby's descent into the birth canal. We encourage positions that open up the hips, such as lunging or sitting on a birth ball, again, squatting to continue to help use gravity to help with baby's descent. And we suggest forward leaning positions, which can kind of take the weight of baby, the load of baby off. So you take that moment to almost rest, like leaning over the bed or often like a support. In the hospitals, they have railings all around. So I often encourage my patients to step away from the room, walk around the hallway, use those supports around the walls to assist. And obviously, these are positions that a patient will be able to do if they don't have an epidural. But with an epidural, we encourage side-lying positions or slightly reclined positions, again, continuing to try our best to use gravity for baby's descent. And Patients often have a lot of questions about an epidural and how am I going to know how to push if I have an epidural? And that's why we take a lot of time to teach pushing starting at 35 weeks, because then they have 35 weeks, 36, 37, 38, sometimes even 39 and 40 we'll see patients for them to continue practicing various pushing techniques. When it's time for them to push, even though they might not have full sensation, everyone's different. Sometimes people still feel a little bit, sometimes not at all. They have worked on it and trained their muscles, and there's muscle memory that's going to help them guide and push that baby out.
I think it's a lot about also just helping them mentally prepare for what's coming. If you haven't given birth before, no one can really tell you what that feels like. But the perineal stretching is partly it's going to help relax those muscles and get them more lax. So I kind of talk about it as like gymnasts are very flexible. They also work on that flexibility all day, every day to maintain and increase that flexibility. So if we're working on that for weeks ahead, those muscles will have more stretch, more give than if not, right? But we, as Aparnaa said, we teach breathing techniques to really help kind of open up and relax. So a contraction will feel like a vice grip on your tummy, right? And so you want to kind of use your breath and your diaphragmatic breath to press against that. And that can really help manage pain. And when we're in pain, we tend to tense up and we need the pelvic floor relaxed to give birth, right? The baby's coming through there. So if the pelvic floor is tensed up because you're in a lot of pain, that could lead to a problem of like not progressing, right? Because baby's just going to be hitting this block. So we want to manage their pain with their breath. And when we take a diaphragmatic breath, our pelvic floor actually relaxes automatically. It's just how the body works. And then you're also getting this release of tension that's created by the contraction. So it can be quite helpful in two ways. And so we teach that breath for the contractions and we have them practice it while they're doing a perineal stretch because it's very easy. Well, actually, it's not. Most people struggle with the diaphragmatic breath, but it's easier to do when you're not in pain. It's much harder to do when you're in pain. So if you go into a little perineal stretch where you're not like causing yourself pain, but you know, that's that deep yoga stretch of like, oh, this is kind of uncomfortable. And you have to hold that and then breathe into that. It way more mimics what they're going to have to do in labor and helps them mentally prepare for what's coming and remember to do that during that time. And then as Aparnaa said, the pushing, we're teaching that with our fingers in so we can feel that are they getting a good pressure? Are they not? What techniques are helpful for them? Like if they use their breath and moaning in this way, does it help? If they visualize in this way, does it help? What gives the biggest effort on my fingers? And that's going to be individual and they are not going to get that feedback any other way. So again, it really helps them to prepare so they know how best to work with their body. Because if they can't push effectively, that would be one reason why you might need intervention, right?
Wish I could go back in time and have this conversation when I was pregnant with my kids. And be honest, even as an obstetrician, I didn't know all the things that you're saying. So thank you for that. And I hope that people who are listening don't make the same mistake I did and actually go and see you while they're pregnant.
I have to say, though, that I want every pregnant person to hear this, to be honest. And I think that this is so important, so crucial, because although I haven't worked on labor and delivery for a few years now, there are definitely some patients who I can recall would push more effectively and some patients who were not pushing as effectively. It's like, okay, you have to go and you have to start running like a marathon, but you don't know how to run. So I have to teach you in the next 5 minutes so that we can get going. And so if you can train for that, and if you can practice that for those weeks leading up to delivery, you're going to be so much better off. I mean, I think a lot of people feel, or I would say that there's a pervasive kind of thought that when it comes to pushing, your body will just know what to do or know how to do it. And I think to some degree that's true. However, there's ways to be more effective and to be more efficient, frankly, with your energy than just pushing for the sake of pushing. And so when I worked as an OB on labor delivery, I always thought of patients, there's only so much gas in the tank. When by the time we get through lots of the laboring process, by the time we get to 10 centimeters fully dilated, which could be days for some people, especially if they're undergoing an induction. And so they may not be sleeping. They may be really tired, hungry, thirsty, whatever, uncomfortable. And now you have to start pushing. Now the hard part, unfortunately, kind of starts, right? And so there's only so much gas in the tank when you start pushing. And so if you can do it more efficiently, more effectively, I think that that is a really important way to help reduce those interventions. For sure, I can think of many patients I've delivered in the past where we end up doing maybe a vacuum delivery simply because of like maternal exhaustion. And that comes with its own sets of risks, right? Pushing can't go on forever. The way that I always explained it to patients was that every time you push, it's like babies going underwater. That blood supply going through the placenta, through the umbilical cord pauses with a push. And we can see that on the heart rate monitors when we're monitoring baby. And so if you do that for a little bit, anyone's going to be fine, right? Where you go underwater, you come back up. You go underwater, you come back up. But eventually, mom is going to get exhausted, but baby's also going to get exhausted too, right? So let's be efficient and effective in the pushing from the get-go. And I think everyone's going to do so much better. I am such a big supporter of pelvic floor physio and doing this pre-delivery. And that's why I was so excited and so keen for this episode, because we see it when Dr. Garcia and I were on labor and delivery, which we don't do anymore, but we definitely saw the effect and saw what it could do for sure.
Yeah. I think we use that analogy of running a marathon a lot with our patients as well, because it's true, right? It's long. And I think part of that is like people or women are not told what to expect. A lot of the like prenatal talks in the hospital is a lot to do with when to call the hospital, when to go to the hospital, how to take care of your baby after, which are all very, very important things. But no one's talking about how to prepare your body for this major event in your life and also what to expect. Like running a marathon, yes, takes endurance and strength, but it also takes mental strength to like, there's going to become a point where everyone in that marathon wants to just stop because they're exhausted. And the people who have trained and mentally prepared for that or have done it before are going to do much better because they can kind of talk themselves through it. You can prepare women for that. Like, this is going to be long. You're going to be tired. These are strategies. So we talk about different cycles. We talk about the breath they're going to use in a contraction. Then we talk about when you're done that contraction, you're on your rest period. That's like if you're doing a HIIT workout, that's your HIIT. And now you're on recovery. Get the water if you can have it. Have a bite if you can have it. Go limp. This is your time to chill so you can kind of save as much energy as you can for the next contraction when it happens, right? And same with the push for sure. Your uterus is working, and yes, your body is naturally going to drive that baby down to a degree, but you for sure can make that much more effective if you know how to work with your body. And I can feel that when we teach is like certain cues just work for people and not others. And they need to breathe like this or imagine this. And their pushing becomes so much stronger in the moment once they get it. And so I do agree with you. It's super important.
Speaking of which, and when we're talking about training, another big misconception or another big myth that we hear a lot is about activity and exercise in pregnancy, and whether, some patients, some people believe that, when you're pregnant, you really should be doing nothing. You should not be lifting a finger, almost bed rest. So what's the reality? What would you guys suggest for somebody for activity in pregnancy? Obviously, keeping in mind that your doctor has okayed you doing physical activity in pregnancy. This is not a high-risk pregnancy, of course.
Great question, mainly because this is a common question that does come up during majority of our sessions. And I have patients even who have been doing like very light or low intensity exercises prior to pregnancy that stop all of that during pregnancy because they're afraid of harming themselves or definitely harming their baby. But you can typically continue whatever physical activity that you were doing already prior to pregnancy, whether that's CrossFit, weightlifting, Pilates, or running. Obviously, modifications may be needed as your pregnancy progresses, but movement is still very highly recommended unless, as you said, directed otherwise by their healthcare provider. And again, like some of those reasons could be placenta previa or if they're at risk for preterm labor. So, various benefits of activity during pregnancy. One, as we said, the whole process of pregnancy, labor, and delivery is like running a marathon. So, by continuing to do activity to your best ability during pregnancy, you're helping yourself maintain strength as well as endurance for labor and delivery. We can reduce common discomforts, so low back pain, pelvic pain, hip pain. Patients have often also reported increased levels of energy, lower levels of fatigue, which is fantastic. We're able to prepare the body for postpartum demands, such as lifting baby throughout the day, lifting heavy car seats, pushing a stroller. Sometimes even those tasks can be very uncomfortable or challenging for patients postpartum, and also just enhancing overall mental health and well-being during pregnancy. When it comes to intensity and frequency, we suggest, and also the exercise guidelines suggest 150 minutes a week of moderate intensity. So this could be brisk walking, swimming, as well as strength training. We use the talk test to monitor intensity, which means that a patient should be able to maintain a conversation throughout their exercise. But again, they will adjust based on how they feel and how their body responds to the activity that they're doing. And I like to share with my patients, especially those where this is not their first pregnancy and they have toddlers at home and they find it very challenging to keep up with exercise, that consistency is definitely more important than intensity. And even just short daily sessions, getting at least like one or two exercises a day or 10 minutes of even walking around the house can take them a long way and have such great benefits on their body. But there are considerations, whether it's your first trimester or your third trimester, that is important to know. For first trimester, patients are at a higher risk of overheating. They will often know that they have to avoid hot tubs or saunas, but it's also important to know that they should avoid high intensity exercise in like hot environments. And staying hydrated is very important, and not exercising to the point of exhaustion. Third trimester, the center of mass will shift. So balance is now affected. We want to be cautious with activities that will put them at risk for a fall, such as cycling or skiing, for example. And then type of activities that we would recommend is definitely strength training. We will always teach with proper form, and definitely breath coordination, which a lot of people struggle with. Walking, swimming, getting on elliptical or stationary cycling. Prenatal yoga or Pilates is great because they will focus on mobility, breath work, and pelvic floor. And functional movements. So preparing for lifting and squatting and all those postpartum care tasks that we talked about earlier. Definitely overall, there's so many great benefits to exercise and activity during pregnancy, but patients need to just be provided the correct education to get started, or that bit of a push to get started as well.
And speaking of education, did you want to tell us about that talk that you do that people can join virtually, right? Can you tell us about that?
Yes, we do offer a free virtual prenatal talk one time a month, which again, free for all patients and non-patients to join. This prenatal talk covers a variety of things, but the main reason that we decided to start this talk is because a lot of prenatal talks out there, they focus a lot on baby and when moms should go to the hospital, but they don't really talk about mom themselves and pregnancy considerations, postpartum considerations. And that's what our talk offers. We talk about what to expect during pregnancy, what are some common concerns during pregnancy, what are some common concerns postpartum, how can we possibly prevent those complications or concerns postpartum, appropriate exercise guidelines during pregnancy, safe return to intercourse, safe return to exercise postpartum. All things that we've noticed that patients have a lot of questions about during our sessions, whether it's their prenatal sessions or postpartum sessions. We've kind of collected all of those main questions and put it into this talk. We also talk about things that we talked about earlier, labor and delivery preparation. And obviously, we don't go into depth into these talks, but for them to get an idea, for them to know the importance of pelvic floor physiotherapy during pregnancy and postpartum. I emphasize postpartum as well because we do have some patients who have just delivered their baby who also sign up for talks and share questions about that as well.
That talk is virtual. So you can join from home and from anywhere. So we've literally had people from Alberta join. It makes it convenient and easy to access, right?
If, someone's listening to this podcast and they're interested, how can they access it or sign up?
It's on our website and there is a link to it. You can scan a QR code or click a link and it will take you to the calendar. So it will show you the next available dates and then you can pick whatever makes sense for when you're delivering. Really, this information is good as early as you can take it. Basically, the more you know, the better you can kind of take on whatever you feel ready to take on in terms of preparing for that. So you don't have to wait too close to your due date to do that talk. But as Aparnaa said, it's never too late either. So if you find out about it a week before, I think it's still valuable. And actually, we have a lot of resources on our website, blogs we've written about considerations for when you're pregnant, activity when you're pregnant. We have a blog on C-sections, what actually happens in a C-section, in a whole document of recommendations of activity after if you had a C-section, because so many people have emergency C-sections they weren't planning for. They know nothing. They get told very little in the hospital and then they're sent on their way and they have all these restrictions given to them and they don't know what they can do and what they should be doing when and how to change. So we have a document that outlines when they can go for walks, when they can start to lift, when they can do this, that they can download. So we can put that in the show notes as well.
That is fantastic. What a great resource.
Mm-hmm.
Thank you so much, you guys, for coming and spending this time with us. This is really valuable. And like I said, I wish I knew this information back when I was pregnant. But hey, I'm almost menopausal now. So I think I still need you.
Absolutely.
I'll definitely be making an appointment. I am not making the same mistake that I made when I knew nothing about this. I'm more informed now, so I'm going to take advantage of that. My mom and I are going to make a double date to come and see you. Thank you so much for sharing this information. It is very useful. It is very relevant for patients who are pregnant. People go through fertility treatment. It can be all consuming, and then all of a sudden you're pregnant. And there is so much fear and anxiety that sometimes it's easy to forget to take care of yourself and your bodies when you're pregnant, because all you can think about is like, oh my goodness, I went through so much. I want to have this baby in arms. So this could be a good reminder that, yeah, we need to take care of ourselves so that we can take care of our babies and babies in plural and more babies after that. Because also one thing we didn't talk about is with every pregnancy, there is a bigger hit, right, on the pelvic floor as well. So yeah, thank you so much for being here. And I think you're going to be seeing a lot of our patients and you'll definitely be seeing me.
Thank you so much for having us and helping us spread the word so people know that there is help and education out there.
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss.
Music from Mixkit, Life is a Dream by Michael Ramir C.
My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.